Hello and good evening, students, parents, ladies and gentlemen, and welcome to the RUMC Alumni webinar series. Thank you so much for joining us this evening. I'm Kasturi from the marketing team at RUMC, and I'm glad to be your moderator for today. Before we get started, allow me to run through a few items so you would know how to navigate around the platform today. Your attendee interface is available on the right corner of the computer desktop, and by default, you're listening to this session using your computer speaker system, and you will be put on listen-only mode. You'll have the opportunity to submit text questions to our speaker by typing them out on the questions tab in the control panel. You may send in your questions at any time during the event. Today, we are here to learn more about practicing medicine with RUMC's Irish medical degree. Now, you would have heard us saying this quite often, that the strong testament to a high-quality medical education is the vast alumni network of RUMC. Many of our graduates have gone through various internship pathways and are now practicing medicine in various countries around the world. And on that note, we have with us two of our alumni who are ready to share their RUMC experience in Ireland and Malaysia. To start it, I would like to welcome Dr. Megat Kamaruzaman from the class of 2007, who is now based in Ireland as a fertility specialist. Dr. Megat, I will pass the session to you.
Okay, so hello and good evening, everyone in Malaysia. Thank you for attending this event today, this talk today, and of course, I'd like to thank the organizers for inviting me to talk at this event today. I've been informed that the majority of the attendees are prospective students and parents, so very warm welcome to you all. It's always nice. It's always a pleasure to come back to RUMC and share my experience as a medical student at RUMC. And I hope you find my talk today informative and helpful in your decision making. All right. Now let me share my screen here. So just a little bit about the content of my talk today. One second. Sorry. So just a little bit about the content of my talk today. I'm going to briefly talk about myself and my background before going through my time as a medical student at RUMC. I will then go on to talk about my training and working experience both in Malaysia and Ireland, and try to touch on the differences and similarities between the training pathway in Malaysia and Ireland. At the end, I'll talk about what inspired me to pursue medicine, and I will offer some advice to prospective students and hopefully future clinicians. So a little bit myself about my qualification. I did my undergraduate degree with RUMC and completed that in 2007. I then went on to do my postgraduate membership training with the Royal College of Obstetrician and Gynecology in the UK and the Royal College of Physicians in Ireland in 2016. I then went on to do my fellowship training in reproductive medicine and completed that just recently in 2020. I have, of course, worked both in Malaysia and Ireland, and I worked in various hospitals in Malaysia and Ireland. And I started off working in Penang General Hospital after completing my undergraduate degree, and I then went on to work in various hospitals in Mayo University and Sligo University hospitals, which are basically secondary based hospitals, secondary based hospitals, before joining Coombe Women and Infant University Hospital, which is a tertiary referral center in Ireland. I then went on to work as a trainee at SIMS IVF, which is one of the leading fertility clinics in Ireland, before being offered a permanent post here. In terms of research and publication, I have to admit I'm not much of a researcher, but I have presented poster presentations, audits at both local and international conference. What I am more passionate about is teaching. I'm the lead coordinator for medical education of RCSI students here at SIMS, and I have been invited to guest lecture at Trinity College in the area of my field. Besides that, I am more involved in patient education, so open days as well as educational videos for patients. Now, I'm just going to talk about my medical school years. My journey as a medical student at RUMC started with me doing my preclinical years in UCD way back in 2002, 2003. At the time, the medical campus was actually in Alsford Terrace, pictured above there, which is actually adjoining to the National Concert Hall. Alfred Terrace is just a walk away from St. Stephen's Green Park, which is like a central park in Dublin. And it is also, this park is also opposite the RCSI campus, just towards the right of that picture. Conveniently enough, this park is also very close to Grafton Street, pictured down here, which is a very popular shopping destination and high street in Dublin. Of course, it's not all studying. We do spend time socializing and going out with friends. And the picture on the right there is actually a very memorable time where it was during the Hari Raya or Eid celebration in front of Malaysian Hall. So as you can see, there is a strong Malaysian contingent, both student population as well as working population. So it was always nice to get together and wear our Malaysian clothing and have Malaysian food. Besides that, as students, obviously we also are able to travel both in Europe as well as within Ireland itself. So the pictures here are all taken during my many travels within Ireland. Ireland's blessed with very beautiful landscapes and picturesque scenery. So there's always something to do and somewhere to go in Ireland itself. Now, upon returning, I returned to Penang in 2005. So at the time, RUMC was known as Penang Medical College. Obviously, what was nice was finally getting home, being close to family and friends, and also, having access to Malaysian food, which is something that we obviously miss when you're abroad. Picture above there is the class of 2007. So I believe it was around 100 strong at the time. And a picture below here is during our graduation day, which is a very memorable day as well, with friends and family. Now, I'll talk a little bit about my journey as a doctor, as a fertility specialist. I started my internship in Penang General Hospital. At the time, I did a 1.5 years of internship, cycling through different specialities before becoming a medical officer in cardiology for a short period, and then becoming a medical officer in Obs and Gynae. So I was there for about maybe 3.5 years as a medical officer in Obs and Gynae. At that point, I decided to move to Ireland. And the reason being was that at the time, as this is a UK-based exam, it was felt that going abroad, having clinical experience, talking to patients overseas would be beneficial in terms of passing the exam. And I think this is very similar to what RUMC offers, so you do your preclinical years and you gain access to all the experience from studying abroad before coming back and doing your clinical years in Malaysia, where it is more suited when you finally graduate. So I moved to Ireland, and I was lucky enough at the time. I had a friend and a senior from RUMC, in fact, who was already working in Ireland, and he put me in touch with Mayo University Hospital HR, and I went for a phone interview and was offered a registrar post there. So I stayed there for a couple of years, and I moved to Sligo University Hospital, and then I passed my MRCOG as well as my MRCPI exam in 2016. This is just some pictures of me at the graduation. So at the time, I thought to myself, look, why don't mission complete? Maybe I should go back. However, my consultant at the time suggested that I apply for the job in Coombe Hospital, and Coombe Hospital is one of the 3 big maternity and gynecology units in Ireland itself, a referral center that manages high-risk obstetrics and complex gynecology cases. And so after applying, I was offered a senior registrar post, and I joined. And I was glad I joined, because it was a lot of good experience working there. I worked under world-renowned consultants, obstetricians, and gynecologists. And I also managed to work in sort of the maternal medicine unit, which manages high-risk obstetrics. So the experience I got there was invaluable. After a year and a half, there was an opening to do fellowship training at SIMS IVF. SIMS IVF is the leading fertility unit in Ireland, and so of course I jumped at the chance to join that. And one thing led to another, and I was offered a permanent post here, and I'm now currently employed as a fertility specialist at SIMS. Now, I thought I'll touch briefly about the differences and similarities between the different pathways in Malaysia and Ireland. So at the top there is the career pathway in Malaysia. As you can see, you initially start with housemanship for 2 years. So you do a 4-monthly rotation between the different specialities, medicine, surgery, orthopedics, ONG, peds, and emergency medicine. You then go on to become a contract house officer, and this will determine whether you are competent or not before being offered a permanent medical officer post. After that, you apply for the master's program. So this is you can either do specialization either through the local master's program, or go and sit for the overseas exams like the MRCOG. You do that for a couple of years before then working under supervision and then being gazetted after 6 months, and then you become a specialist. In Ireland, it's a little bit different. You do internship for a year in medicine and surgery. It is very competitive to get an internship post in Ireland, but once you finish that, you then can apply for the basic specialist training for further 2 to 3 years. So you will become a senior house officer, and you will cycle between the different hospitals for this time. And then you apply for the higher specialist training, which is again another highly competitive sort of training post. And if you finish this, you'll then be in the specialist register. Now, this is the application process to become an intern in Ireland. Now, admittedly, I haven't worked as an intern in Ireland, but I thought I put up the slide, and you can get this information actually from the Health Service Executive website, or HSE website. There's basically 3 stages to this process. The first stage is an online application, and eligible applicants, including those who are in the academic track selection process, will be invited to stage 2. At stage 2, they will look at your centiles, your rankings, which is provided by the head or dean of the medical school. And depending on where you rank, there will be a matching process. Okay, so applicants are matched to an intern post, and those who are unsuccessful will be put in a reserve list and maybe allocated to a decline post. The applicants and the hospitals will then be informed of these allocation places, and then you go on to do your pre-employment checks, mandatory induction for a couple of weeks before being appointed as an intern. Now, what inspired me to pursue a career in this field? To be honest, medicine wasn't my first choice. And believe it or not, I was more interested in doing architecture in my teenage years. And I was actually offered a place to do architecture in University Malaya. However, I got a little bit of encouragement by my parents, and I was honestly, genuinely inspired by them, who are both doctors, and I chose to do medicine. I did choose obs and gynae mainly because my father is an obstetrician himself, so I always thought that looking at what he does, it was a very fulfilling job, and so I joined the obs and gynae team. And while I was there, I was more interested in doing urogynecology rather than pure obstetrics. And this was because I found the surgeries very interesting, very technical, and I was very interested. I thought I would definitely want to do urogynecology. So how did I end up with fertility? To be honest, I think it's more by chance. And I think in life, what's planned doesn't necessarily always go as you think it would. And I think one has to be one has to be flexible, one has to be able to pivot in order to progress and be successful in their careers. Now, what advice would I have to give or offer for RUMC or prospective RUMC medical students? I would say do it for the right reason. If you think you will be really rich doing medicine, I think you should think again. I think as doctors, you will have a comfortable life. You would have a secure sort of way earnings. But if you want to make a lot of money, I think you should maybe steer and do a degree in business or accounting. You definitely will earn a lot more going down that route. Doing medicine also involves a lot of hard work, long hours, and one has to be consistent, especially during the medical school years. You have to be consistent in your study, and you also have to have perseverance. There will be up and downs, both as medical students, as doctors. You might fail an exam, you might not be able to help patients in certain ways. So there's always ups and downs. So I think one has to be strong-willed and persevere despite these obstacles. It also involves a lot of continuous learning. As you can see, even after finishing undergraduate training, there's still a good 10 years before you become a specialist or consultant. And even then, even now, there's always something new that you learn, and there's always something that you need to update yourself. So it does involve a lot of reading, a lot of continuous learning throughout your career. Finally, I think medicine is a noble profession. Ask any doctors, and what gives them the most fulfillment in this job is being able to help patients. Being able to help patients get better, being able to help patients achieve their goals. That's the most fulfilling when one does medicine, and I think it is a very, very noble profession. So thank you, and I welcome any questions, I believe, at the end of this session.
Okay, thank you so much, Dr. Megat. So without further ado, I would like to welcome Dr. Ganesan. Dr. Ganesan is our alumni from the class of 2013, and he's all ready to share his journey in medicine with RUMC with our audience today. Give me one moment. Dr. Ganesan, over to you. And by the way, audience, sorry, Dr. Ganesan, sorry to cut you off. Audience, if you have any questions regarding the presentation made by Dr. Megat earlier, you can drop them in the questions pane and we'll address them later, yeah? Okay, Dr. Ganesan, go ahead.
Right. Just a minute. All right. Very good evening to everyone. Thank you, Madam Moderator, and thank you to the organizers for inviting me to share my experiences in Ireland and in Penang. It was an excellent presentation by Dr. Megat before me, and even though we probably are 6 years apart in terms of university life, but I think there are a lot of similarities that we share, and which I believe to date it would be the same scenario as well. So so my name is Ganesan and I was from the class of 2013. So just a bit about myself. I graduated the National University of Ireland degree as as all our RUMC graduates would be. And then subsequently, I've just obtained my membership into the Royal College of Physicians, MRCP UK. So in Malaysia setting, it would be a parallel pathway program equivalent to the master's program. So, and I'm currently just started my examination into becoming an internal medicine physician. So, my career so far, I graduated in 2013, did my house officership in Hospital Serdang. Subsequently, I was in Terengganu Kemaman, which is a district hospital, for 2 years in internal medicine. And subsequently, in 2018, I've been in HKL ever since then, up to today. Initially as a medical officer, and I've progressed to become a medical registrar. So just a bit of awards. So I was fortunate to receive this Star Scholarship Award in 2008. I think I was probably one of the last few batches that were able to apply for the scholarship, or it was being offered. So I was the fortunate recipient for the RCSI one. So along my career, so I was fortunate also once again to receive the Anugerah Pekerja Cemerlang, which is a certificate of for a reward for your excellence in service by the Ministry of Health. So this would be the main part of my talk, I guess, to share with you the experiences that I've had in RUMC, right? From RCSI, compared to Dr. Megat, who went to UCD, I was in Royal College of Surgeons in Ireland. So I will start from there. It was a very colorful 5-year journey for me and all my friends, even all the other alumni, I'm sure, would share the same views as me. So we had a very colorful life in Ireland. So in RCSI, I was very active in extracurricular activities as well. So I was president of the Malaysian Society, which is formerly known as PMCSA. RCSI and the names have changed to Malaysian SOC and even Southeast Asian Society. So a part of Malaysia, I represented United Kingdom and IRE Council. So it's a UK and Ireland committee to represent students, Malaysian students overseas in Ireland and UK. So the union representative, and those who have gone through RCSI or those who will be going to RCSI would be definitely become familiar with International Night, which is the biggest cultural event. So in RCSI, there's, if I'm not mistaken, there's 60 over national students from 60 over nationalities studying together. So it's a very colorful event. I was part of the coordinator and also the committee to organize the Malaysian contingent for it. And we were fortunate to be champions in one of the years in 2009. So I was also, I mean, there's a lot of clubs. Clubs are very active in Ireland, just like in Malaysia as well. So, and I had a chance to explore archery, and I was part of the archery team in RCSI, and we participated in the Irish League. So that's the extracurricular part, but the curricular part is equally exciting as well. So I think the picture in the middle here is our anatomy dissection class. Okay, I did not study in the black and white era, but why I posted this picture, the room looks pretty much the same as this. So we study in a place which is full of history, hundreds in years of history, and we share the same room that many great surgeons and physicians have come by. So our card signing, our anatomy classes were definitely a very big memory. We literally operate or come in contact with our first few patients in a cadaveric form. So, and we really learn a lot from them. So that was definitely one of the most important highlights. So besides that, besides history, the modern medicine, the preclinical and clinical years were also a very good exposure in Ireland. So we are learning from the prime lecturers there who have got a very good understanding, who are very well research orientated, and they teach you the preclinical part. And you've got a very early exposure into clinical years. In the second year, you already start going to Beaumont Hospital for clinical years, for patient encounters, hospital environment setting. And that was definitely an eye-opener to set the stage for what's going to come for the next few years. In Ireland, I think you would have probably, when you read about Ireland, the common thing is Irish are the friendliest people in the world. So, and communication is, I think, you can not learn better from them, from anyone else. So, communication is very well emphasized in Ireland. How you interact with your patients, with your colleagues. So, how do you take a good history and such? So, these are the modern medicine, a modern way of teaching. Was excellent as well. So just not just history, but the modern aspect of things, the technology, the facilities were also top notch in RCSI. So coming back to RUMC, equivalent to that, a lot of curricular activities that we had. So as part of the Peer Assisted Learning Society, which I believe is still ongoing, so part of the Adventure Club. So from the Adventure Club, we went to climb Mount Kinabalu. This is the Frisbee competition that we took part from RUMC. This picture here is the Ireland PMCSA committee that I had, which is a very colorful team that I had as well. And this is back in Penang, our Peer Assisted Learning Society. So, of course, memories in Dublin, I think the four major mantra that all of us would have is friends, fun, culture, traveling. Of course, the studying goes on as well. And as mentioned, our card signing, anatomy, preclinical years, there's a full memory to that. But I think we don't capture much pictures. So the pictures that we capture would be around here. So this is the archery competition that we go for, traveling with friends to many countries around. Traveling is very cheap in Ireland, in Europe. I mean, of course, in the pandemic era, it's a bit more difficult now, but I'm sure it's going to open up soon and traveling is going to be easy once again. So we have heard of a lot of St. Patrick's Day, Halloweens, and also we experienced a lot of that with the locals, with the Irish and other nationalities in Ireland. So all Malaysians go through. We'll talk about the Hari Raya Open House in Malaysia Hall, which is one of the most important Malaysian events that everyone goes for, and this would be it. Experiencing snow together for the first time in Ireland was excellent as well. Ireland doesn't get much snow, but when you get snow, it's an unforgettable thing. So this is our Malaysian night, the year that we won in 2009. This is our sports day that we have annually between RCSI and UCD. In both the Malaysian societies, we compete with each other, we take turns. So this was the year that we actually won. And I mean, just to make a note of it, of course, we won that year competition, but actually UCSI and RCD come very close in terms of curricular and extracurricular activities as well. When we come back to Penang, we all form together as one group and we can really pick off at the same point where we left off. There is no difference in I'm better or you are better. We're equal in a lot of ways because the Irish training is just as such. But in UCD or RCSI, it's pretty much the same. We have a very colorful student life and also a very good education from there. So this would be, I think when you're abroad, you try new things. So I tried to go Afro. Some people said I was too stingy to pay for a haircut, but I would like to blame it that I was just trying an Afro hairstyle, which didn't really go on too well, but oh well. If not, then when else to try, right? So coming back to Penang, the clinical training, I think the second 2.5 years of our transnational program would be the clinical aspects of training. So the most important thing that adapted us so well into the local training setting is that whichever local hospital you go to in Penang, and its associated hospitals for teaching, RUMC students have got a very good reputation, right from the nurses up to the medical officers to the consultants. They've got a very good reputation, and that makes it easier for you to go through the wards for your day-to-day clerking and training. So RUMC is a large training center in the sense that, yes, our college is very cozy and comfortable, just nice for us. But we have got a Penang General Hospital, which is one of the biggest hospitals in Malaysia, also seated with Seberang Jaya Hospital, Taiping Hospital, and many other small clinic kesihatan, district health clinics. So I think it's a very good training center. You get a vast variety of cases to experience, to learn from. Patients are best teachers, and with a large pool of patients, training center, it's a bundle of learning for us to go. So another thing of note is a lot of our lecturers are very good in touch with the local hospital consultants. So we get to know very good cases, and they bring us around, and there's more ease in moving around these hospitals, and which is very important in terms of training as a student. So our patients from local community, which makes it easier for us to communicate and also learn from, and our local community is also very approachable to students as well. So I think it's an excellent way of learning. RUMC is city center, so as Dr. Megat had initially mentioned, coming back to Malaysia or Penang was the food. Being in RUMC, whether it's lunch or dinner or breakfast, there's so many excellent options to go for, and even on the weekends as well. So the last thing about Penang that was important, we had a lot of hands-on training. So this is okay. So the one on the bottom right is just a picture of house offices, and a few of us are 3 hours in this picture are actually from RUMC as well, and we did excellently and finished our housemanship in 2 years with no glitches. This is the this is the picture just after we finished our final exam, and yeah, final exam, yes, but we were all full of smiles. And this is a good picture of mix of our UCD and RCSI colleagues, which we came back and formed as a team for the final 2.5 years here in Penang. So we also had a good opportunity, exposure to Hospital Bahagia. Ulu Ginta heard so much. We wanted to admit some of our friends, but I guess it was more of the training and a very good experience that we had. Yeah, we did not admit anyone. We all came back to Penang safely. So just a bit of what that has put me into. So all my training has put me into where I am today. So I am actually enjoying medicine, practicing medicine. So transition from a medical officer to a registrar, what has been an excellent process because it's truly what I always wanted to do. And why internal medicine or internal medicine registrar is because my personality really suits. I'm not really a surgeon, I'm more of a physician. So my personality really attracted me to what I'm doing today. So, and that'll be the reason why I'm doing what I'm doing. So I enjoy my day-to-day activities. So as a medical registrar, there's less of the paperwork in terms of blood taking and also filling out forms and things. There's more about patient management and more responsibilities, making decisions and making a difference in patients day to day. So just a clinic setting, bone marrow examination. This is a pericardial tap. These are rare procedures, but in Malaysia, as a registrar, you're able to do all of this on your own as well. So just to highlight the difference between, highlight memories in Dublin and Penang, I think there's plenty. I mean, we have given a time limit by our organizers, so we don't exceed. But if me and Dr. Megat had an unlimited time, we can go on and on talking about our times in Dublin and Ireland equally as much. There are two different worlds, but you truly have to make the best out of it, and definitely it'll be very easy to achieve that. It's of note, it's been the best time of my life. Most of the universities you go to, 5 years you're in one position in one locality. So, but in RUMC we get Ireland and Penang, so you get 2.5 years to redo your student life. You experience everything for the first time in Ireland. You come back to Penang and you redo the same thing. You go through the same new experience, the same memories that you create in a different way. Truly the best time so far. Advice to RUMC medical students, I guess there's nothing better than learning a new language and culture. So that would be going to Ireland. So when you expose yourself to the local community who's very friendly, and also the Europe region, as you travel along, you learn so much. You don't really have to learn Gaelic, which is the Irish language. English is perfectly fine. They've got a thick accent, but in terms of training, in terms of teaching, training, and your day-to-day with your patients, it's not a problem as well at all. So my advice would be to make the most of that. Be a holistic doctor. Just don't look at the patient and values and numbers. RUMC and RCSI or UCD trains you to just look more into patient social welfare, social issues, and of those kind of things. So you have to treat your patient as a whole and parade the flag high. I think a lot of our RUMC graduates are doing excellent in their respective fields throughout the world. So do continue to take the baton from all of these people and continue to excel. So yes, we're in the COVID pandemic, so stay safe. These were the pictures of Malaysia in what I went through in the COVID pandemic, or rather what's becoming an endemic now. So stay safe, practice medicine, and enjoy what you're doing. That's all from me. Thank you.
Thank you so much, Dr. Ganesan, and also Dr. Megat, for that excellent sharing session earlier. And I hope our prospective students here are inspired by your experiences. And or for those who were interested to do your internship abroad, we hope the information shared by Dr. Megat earlier on the internship pathway in Ireland is helpful for you. We will now move on to answering the questions received during the session. And for that, we have the panelists, Dr. Megat and Dr. Ganesan, with their webcams on for the session. And to the audience, please feel free to send in your questions now. Yeah. Okay. Let me just pull in the question. Okay. There is a question here about can we do the preclinical years in Malaysia and the clinical years in Dublin? But I think RUMC program is the vice versa. You do the preclinicals in Dublin and clinical years in Penang. So maybe the doctor can reiterate it. How do you think the transnational delivery of the RUMC program had shaped your career as a doctor? You can share your experience. How does it help when you're studying in Dublin, the preclinical years, and also Malaysia when you're doing the clinical years? We can start with Dr. Megat.
Yeah, I think the benefits of studying abroad is obviously you get access to lecturers, professors who have vast experience, years of experience teaching medical students. So you gain a lot in terms of their experience, in terms of their knowledge. And then once you return back to Malaysia, you're more acclimatized to sort of the diseases, the medical conditions that's more in Malaysia. So for example, I remember that where during my time as a doctor in medicine, we had a lot of patients with diabetic complications, something that you don't really see overseas. You don't see a lot of complications that you see in Malaysia. So in that sense, coming back, you get to see more conditions that are more suited in Malaysia. So I think that was very, very valuable.
Okay, and Dr. Ganesan, how about you? What do you think of the transnational delivery, the structure of the program, and how this structure helped to shape your career as a doctor?
Yeah, thank you, Kasturi, for the question. So I would totally agree with Dr. Megat, and my views are exactly the same. I think there are very few universities or colleges that provide transnational in this way, whereby you do your preclinical in Ireland and your clinical years in Penang, in Malaysia. But I think that would be one of the reasons that attracted me to this program was this arrangement, because as Dr. Megat said, in Ireland, you're learning from, so to be very honest, in terms of research, Irish people or the Europeans and that society have got more research ongoing. So they've got the latest, and these people who are teaching you there are of their prime research levels, and they are of their prime of their careers. So you're learning from the best of the best at the preclinical years. And when you come back here, you get into a local setting, as Dr. Megat said, diabetics and complications and things, which is going to be what most of us are going to be practicing in a house officership and medical officership. So I think it's very, very relevant to be undergoing our training in Malaysia as for the clinical years and preclinicals in Ireland. I think that's an excellent match.
Thanks, Dr. Ganesan. Moving on to the next question. This one I will direct to Dr. Ganesan, and Dr. Megat, you can add on. How did you manage your time being a medical student and also being active in extracurricular activities at the same time? Dr. Ganesan?
Yeah, so I think that was a very, very big challenge, but I think I enjoyed what I was doing, whichever way it was. In terms of going to class, in terms of attending lectures, that was also fun. And at the same time, going to extracurricular activities was also fun. It was not a chore. So I was able to make time for both. And I think as a doctor, you need to have very good time management skills. And you will learn this if you take part in all these activities. At the same time, you balance your studies as well. So I guess it's just experiencing it and going through it, you will definitely be successful.
Thanks, Dr. Ganesan. Dr. Megat, would you like to add on based on your experience in Dublin and Penang?
No, I agree with Dr. Ganesan. I think one has to be able to manage the time, both studying as well as the social life, extracurricular activities, because I think you need a balance. You need a balance. Otherwise, you'll just be stressed, and you'll just be focusing too much on studying isn't good either.
Okay, thanks, Dr. Megat. Now I'll move on with the next question. This is about, how do you manage living expenses while you were in Dublin for the first 2.5 years? Dr. Ganesan, can you start first?
Sure. So I think being Malaysian and you go there, you do the maths. So you times 5. So the biggest problem was, I think the first few weeks, me and my colleagues, friends, were literally just eating off 90 cents Duns sandwiches kind of thing, like bread, toast. Literally, that was lunch. But that's not the way to go, I guess. So as you go, you realize that you have to be thrifty with what you spend. You don't unnecessarily spend, but at the same time, you cannot be too cautious with what you spend and end up living on bread for the rest of your 2.5 years. It's just not feasible, and it's really not healthy. So you do indulge in some things. Sometimes you go on a weekend and things, but you also have to conserve at the rest of the time. So I guess you just have to, you have to spend, but you have to be careful and keep count with what you're using.
Okay, thanks, Dr. Ganesh. The next question for Dr. Megat. Dr. Megat, since you are based in Ireland, the student would like to know how cold is the weather in Dublin during winter, and should he buy the winter clothes in Dublin or Malaysia?
Yeah, I think there's seasons. There's 4 seasons in Ireland, so you do get warm weather. You do get very nice, comfortable weather. But yeah, at the moment it's 3 degrees outside. There's a storm. Storm Eunice is going on, and everyone is indoors. So I think you experience the different seasons as time pass. And like Dr. Ganesan said in his presentation, although Ireland doesn't get much snow, we do get it from time to time. So it is nice experience, especially as as someone who's never seen snow, to suddenly experience that. It's always nice. Now, in terms of winter clothing, cold weather clothing, I think that depending on when you come to Ireland, you need something. You need some sort of cold weather clothing, but a lot of the clothing can be bought in Ireland itself at a much cheaper price. And fashion-wise, it'll probably be a lot better compared to what you buy in Malaysia. And you can always buy winter clothing during the sale period.
Okay, thanks, Dr. Megat. And there's another question. Dr. Ganesan, how do you make your med school journey easy when everyone else says med school and the journey of being a doctor is undeniably hard?
Well, there is some truth to it. It's a very difficult profession to prepare to study for and also to practice in. But as Dr. Megat said, the practicing part is a very noble profession. So when you do make a difference, that motivates you to do more. And if you're doing the right thing, you'll get a lot of compliments around the way. I know shouldn't be expecting it, but I can promise you it will come along, and that will make you feel good in what you're doing, in practicing, in saving lives, in making a difference. So it's a very noble profession, and if you put money out of it, definitely it's very rewarding. So I think in terms of your day-to-day, how to go through your housemanship, even as a house officer, you can make a major difference. Your life is going to be the hardest in that period, but you are closest to your patient and you can make the most difference. So going to a medical student, it's definitely challenging. A lot of lectures. Some things can be very dry. Some things are very hard to comprehend and memorize. But if you put your head down, I mean, not anyone can get into med school per se, and you chose med school knowing that you wanted to do it. So with that, I'm sure you're able to study, remember things, and also practice and also ace your exams with ease. So yeah.
Okay, thanks, Dr. Ganesan. Dr. Megat, would you like to add on to what Dr. Ganesan had said? How do you make your med school journey easy when everyone says it's quite hard?
Yeah, no, it's just like Dr. Ganesan said. I think in terms of making it easy, one has to. It is you do have to balance your time, and I think in terms of when you do finally graduate, I think the most rewarding thing is when patients come up to you and say thank you. That although you shouldn't expect it, it is very, very rewarding. So yeah, no, I agree with what Dr. Ganesan said there.
Okay, and there's another question for you, Dr. Megat. How do you apply and remain as a doctor in Ireland with your RUMC medical degree?
So basically, for me, I applied through one of my seniors in Ireland. I applied to the hospital directly and sent in my CV, and then I did a phone interview and was offered a registrar post. It depends on where you are in your career or where you are at the time. For example, if you finish medical school, you can actually apply to do internship directly. You can get a bit more information from the HSC website, and RUMC is recognized, so you can apply directly. Now, this is very competitive, and they do look at your academic scores, and you'll be ranked accordingly. So you could apply there. Otherwise, Malaysian internship is also recognized in Ireland. So you could do internship in Malaysia, complete it, and that would be recognized as internship training in Ireland. So you could apply it at that stage. Now you would have to maybe go online and apply directly to the hospitals, or you could go to there are websites that advertise jobs for the hospitals in Ireland. So there's various ways where you can apply to work in Ireland.
Thanks, Dr. Megat. And yes, so now Dr. Megat being a fertility specialist and Dr. Ganesan being a medical registrar, I believe the audience would like to know, what do you do on a daily basis? So maybe we can start with Dr. Ganesan. Can you share with us what is your role as a medical registrar at Hospital Kuala Lumpur is like?
Sure. So thank you for the question. So my day, I mean, pretty much we in Malaysia traffic jam, so we start early, so we make it into work early, so 7:30 plus you're in, and then we so I'm a medical registrar, but I'm currently attached to the cardiology unit, so I'm a cardiology registrar in a way. So we take Passover. We have a Passover meeting for about half an hour. Over coffee, quite relaxed, and then we go in to start our rounds. So we do our rounds, review the patients, and then we go on to our clinics, which are also concurrently running. We've got a team running the clinics, so we head into the clinics. Along the way, in between, you may have procedures like, I posted a picture of a pericardial tap, which is you're tapping the lining of the heart, which has accumulated fluid. So along the way, you may have procedures to do. So we have to manage our time to make time for that as well. At the same time, finish our clinics on time. And then lunch comes in, and then afternoon we carry on with our afternoon clinics, and then if procedures, if any, and we should be, any new admissions or any emergency departments, we do get cardiac referrals from there. So we go down to the emergency department to have a look at our cardiac patients. So it's a very walkabout day. You make a lot of, make 10,000 steps a day, definitely. So, and KLGH being a very big hospital, very widespread, and with a lot of facilities involved in the in KLGH in terms of subspecialty, sorry. So we're just not cardiac origin. We got a lot of referrals from different departments, from oncology to surgical based wards. So we do a lot of things, a lot of procedures take place. So that will be my day to day. We end about 5, 6 o'clock, I guess. Good days 5, and then beat the jam and come back home. So that will be my day at work pretty much.
Okay, thanks, Dr. Ganesan. Dr. Megat, how about you as a fertility specialist? What is your day-to-day routine like?
Yeah, it's very similar to, believe it or not. You start off early, you go to work just before 7 to avoid the traffic, and I do an 8 to 5 or 8 to 4 job. I'm fortunate enough not to do on calls because I work mainly 8 to 5. So most of the time is either speaking to patients, previously face to face, now through Zoom, and then doing surgical procedures. So there are some surgical procedures, some clinical procedures that you do as well, and yeah, you go back usually at 4 or 5 o'clock in the evening, and yeah, I'm fortunate enough not to do on calls anymore.
Okay, and Dr. Megat, if you don't mind, we would like to take you back to your time as an intern. How was your experience of doing internship at Penang GH? And can share a bit about the rotations that you've done, any memorable experience? Yeah.
Yeah, so I did a 1.5 year internship in Penang, and at the time you cycle through, you do a 4-monthly rotation. So I did medicine, surgery, obs and gynae, and orthopedics. So I didn't at the time. Previously, we didn't need to do all the full 2 years rotation. It was hard, especially you at the start, nothing quite prepares you sort of working life. So a lot of stress initially, but with time you get used to the work. And obviously, being in Malaysia, you have a lot of family support and friend support as well. So that was really helpful. I suppose, yeah, Penang was very good, because obviously you also bump into your former consultants, your former professors. So they would always approach you, and sometimes offer you advice, from time to time. So that's always nice. Yeah, so that was my time in Penang.
Okay, thanks, Dr. Megat. Okay, we have a question for Dr. Ganesan. How do you think the healthcare industry has evolved in Malaysia? And on this note, what will your advice be for aspiring doctors of the future?
Okay, I guess in Malaysia, healthcare system is a bit different compared to a lot of other countries, whereby the government hospitals offer excellent services at a very minimal rate. I mean, basically sort of free. You just pay for certain implants, but that's about it. If not, your treatment and your day-to-day costs very free. So majority of the treatment and our Malaysian population would attend the government hospitals. So in terms of that, if you're talking about the local setting, the industry-wise, we have the best of facilities that you can have around the world. You have pretty much almost everything in Malaysia. So in terms of a training for a surgeon or physician to be, you've got a vast number of cases. You do a lot of procedures, and you have got a lot of toys per se, or tools for certain surgeons and certain departments. And it's very hands-on in terms of training. It's excellent. If you talk about after that going to the private sector, which is equally just as good, you have got the best of people out there in the private practice with the best of facilities in all the private hospitals. So if you decide to have a swap from the government phase to the private phase later on, I think it's a very good thing as well. Advice.
Yeah, go
sorry.
ahead, Dr. Ganesan.
I think you were asking about the advice to the future doctors. I think initially, if you come back to Malaysia, I think the whole contract doctors thing, so it's becoming quite a scene in Malaysia. But I guess if you do your specialization, your papers early on, it's becoming more competitive. But if you do it early on, it stands you a better chance to continue your career, or secure a proper spot in the local setting and move on. But I think the contract doctors issue is slowly is being addressed, and I think it will resolve soon as well.
Okay, thanks, Dr. Ganesan and Dr. Megat. The same question, but on a global perspective, how do you think the healthcare industry has evolved? And for those who are considering for medical practice abroad, what would your advice be?
Well, I think overall, the practices, be it in Ireland and Malaysia, they're quite similar, believe it or not, in terms of the technology, the experience. So one can get, equal amount of experience in Malaysia as one would in Ireland. I would say that, in terms of hands-on, I do agree with Dr. Ganesan, you get more hands-on if you work in Malaysia. I remember as a houseman, as a medical officer, being able to do more, procedures than one would do in Ireland. Now, obviously, because we're it's a smaller population. In terms of what was the question again? The second question again?
Your advice if students are considering medical practice abroad.
Yeah, I think in terms of my advice is obviously you need ideally maybe go early in your career. That way you are able to sort of apply through the various training schemes. So you can apply early and get into those training schemes early, and that will stand you better in terms of getting supervised training if you're in Ireland. Otherwise, like I said, it depends on what you want to do with your career. If there's various things you can do. If you're thinking of doing a membership exam, you can come for a short stint for a short while. I have seniors who've come in, done the exams, and gone back, and it's now a specialist back home. So it depends on what you want to do. How long you want to stay in Ireland. Having said all that, a lot of times nothing's planned. I thought I'd only stay in Ireland for 2 years, and 10 years on, and I'm still here. So again, life, is funny, and things change as one grows.
Okay, thanks, Dr. Megat. And we'll take one last question for the day. Okay, the question is, do Dr. Megat and Dr. Ganesan think that robots, as in technology, will take over human in a few more years? Maybe we can start with Dr. Ganesan, followed by Dr. Megat. Dr. Ganesan?
Robots taking over medicine. Okay. Actually, I think it's already starting to come into practice. I think there's a lot of robotic surgery going on. So I think the field of ONG and surgical-based fields, a lot of robotic surgery is taking place, which is precision-led. But it's still, operator is still somewhat the physician, the surgeon. So in terms of, if you talk about a non-surgical aspect, physical aspect, there are a lot of apps out there that you put in the symptoms that you have and all that, and it'll give you a possible diagnosis and a recommended treatment plan. So all this is taking place, but at the end of the day, I still think the best way of treating is by a physical touch. As a physician per se, I think when you examine a patient, it makes a lot of difference. And even as a patient, if you go to a doctor who doesn't touch you but just does an x-ray and gives you a diagnosis, you wouldn't be as satisfied as compared to a physician who actually listens to your lungs. That gives satisfaction and reassurance. So definitely the way to go is still manpower based, I think.
Thanks, Dr. Ganesan. Dr. Megat, your viewpoint on this, please?
Yeah, I agree. I think the human touch is probably the most important. As medical students, we were taught, history, examination, and inspection and examination. So I think the majority of clinical diagnosis is still done via this approach. But yeah, technology does help. A lot of surgeries are being helped, with various new advancement like robotic surgery, but you still need a surgeon behind that instrument. But yeah, like even in fertility, where we're using artificial intelligence to assess embryos, and we're using artificial intelligence to observe the development of certain things. So there is a bit of what do you call this? A bit of help in that area. But again, nothing beats the human touch. You know, nothing. A robot can't deliver bad news to patients. A robot can't comfort patients. So a human touch is still very important.
Okay, thanks both. And with that, we'll end our Q&A session. And Dr. Megat, do you have any final words for our audience today?
Well, look at like I mentioned in my slides, I think one has to when one considers doing medicine, I think you have to do it for the right reason. You know, there are a lot of people going into medicine thinking that they will make a lot of money, and yeah, in some practices you can make a lot of money, but I think that's a minority rather than a majority. The majority will make a comfortable living, and so you need to enter it with the right frame of mind. And I think there's nothing more fulfilling than helping patients get better. And if they thank you, then that's a bonus.
Yeah. And Dr. Ganesan, how are you?
I think so. If you have chosen medical as a profession, I think well done. So it's something that it's very rewarding in its own way, but comes with its challenges as well. So well done, and make the most of your university college life. I think just don't be bogged down with studies. Make the most of everything. You need your other skills as a doctor as well. Just your knowledge alone is not going to suffice in you handling your patients and your day-to-day challenges. You need everything. Be a holistic doctor. So when you study holistically. Make the most of your 5 years. If you've joined RUMC, well done, congratulations.
Okay, thanks both. Thank you, Dr. Megat, for taking this. Okay.
Yes.
Okay.
Yeah.
So thank you, Dr. Megat, for taking us through your journey in RUMC and Dublin, and also sharing about your pathway to do internship in Ireland, and Dr. Ganesan for sharing your experience and perspective about practicing medicine in Malaysia. And to the audience, thank you for tuning in to the RUMC Alumni webinar today. The 2022 intake for undergraduate medicine and foundation in science program is now ongoing. For more information on our programs and guidelines for applying, you may visit our website at www.rcsiucd.edu.my. And if you have any other questions, please feel free to email us at enquiry@rcsiucd.edu.my. And once you leave the session, you will receive a short survey on today's event, and we would appreciate it if you would complete that and provide your feedback. You will also receive a follow-up email within 24 hours with a link to view a recording of today's event. And finally, on behalf of RCSI and UCD Malaysia campus and our panelists here, we wish you a good evening ahead. Thank you and stay safe, everyone. Goodbye. Thanks, doctors.
Thank you.
Bye.